Hello everyone. Today I'm going to discuss about the one of the important topic in the rehabilitation. So that is the guided educations, so especially for the cerebral palsy. So before explaining about the guided educations, so in the cerebral palsy, so I would like to explain about the cerebral palsy. So in this topic, I'm going to discuss about the what is cerebral palsy and also what are the causative factors and risk factors, what are the different type of the cerebral palsies, and also what are the medical management, surgical management, and also rehabilitation management. So here I'm going to discuss about the what is the definition of the cerebral palsy. So if you see the definition of the cerebral palsy, it is defined as group of disorders resulting from the permanent non-progressive cerebral dysfunction developing before maturation of the central nervous system, affecting the locomotor system. So it's especially it's damaging the locomotor system, the especially who are having the damage in the brain. So it may give the abnormality in the motor functions. So it may lead to the temporary or maybe permanent disabilities. So it is a non-contagious motor condition that causes the physical disability in the human development. So it is a non-contagious. So it's not going to spread from the one person to another persons. So it's because of the any problem in the child development, because of the mother complications or maybe child complications, may chance to get the motor impairment. It may use the physical disabilities. Although brain lesions that results in the cerebral palsy are not progressive. So it's not going to be the progressive development. So because of the brain damage, it may give the disabilities in the child. So it's a clinical picture of the CP may change with the time. So it won't progress the damage in the brain tissues, but because of the abnormalities developments, because of the motor abnormalities, it may progress the disease. So it may give the disability progression, but it may won't give the any progression in the damage of the brain tissues. In addition to the primary impairment in gross and also fine motor functions, there may be associated problems with cognitions and also seizures, visions, swallowing, speech, bowel and bladder, and also orthopedic deformities. So it depends upon the involvement of the brain structure, the person may chance to get the abnormalities. So for example, if involvement of the frontal regions, so the symptoms will be different. Or maybe is the temporal lobe or parietal lobe, occipital lobe. So depends upon the involvement of the brain structures, those symptoms and also the disabilities are going to be vary. So we are going to discuss in detailed manner so about the cerebral palsy. So what is the criteria for the diagnosis of the cerebral palsy? So these criteria is mainly that depends upon the neuromotor control deficits that alter the movement or postures. So because of the alteration of the neuromotor control, so it may lead to the abnormality in the movement as well as the postures. So depends upon the involvement of the movement, or depends upon the involvement of the brain tissues, it may affect the either upper limbs or maybe lower limbs or trunk also going to be involved. So we are going to diagnose according to the involvement of the limbs regions. Is the upper limbs, either both upper limbs or single upper limb is involved, or maybe both upper lower limbs or only single limb is involved. So depends upon the involvement, we are going to divide the, and also we are going to diagnose the cerebral palsy. And also next we are going to according to the static brain lesions. So where exactly having the brain lesions? Is it in the frontal regions or parietal regions or temporal or occipital or any particular region is affected? So depends upon the involvement of the brain. So we are going to diagnose the cerebral palsy. And also acquisition of the brain injury either before the birth or the first years of the life. And also we have to diagnose the one, means we have to take the history, proper history from the mother, as well as we have to take from the who already bring to the clinic. So we have to take the proper history from the caregivers as well as the family members. So the injury because of the before the birth or after the birth. So these things are the criteria for the diagnosis of the cerebral palsy. So cerebral palsy is the term. So it's nothing but is a cerebral paralysis. So if any patients are if because of the damage of the brain, so it may use the paralysis of the upper limb, either upper limb or lower limb or a trunk. So this is formally known as the cerebral paralysis. First identify the English surgeons, the William Littles in the 1860s. So that is the reason cerebral palsy also called as is a Little's disease. So because of the first identify the English surgeon, that's a William Littles in the 1860s. So on behalf of his name, so this condition is also called as the Little's disease. So believed that asphyxia during the birth is the chief cause. So according to the Williams Little, so is according to his belief, so is because of the asphyxia. So during the childbirth. So because if the during the delivery, if the mother deliver the baby, so any abnormality in the birth canal, so such as if the birth canal is a smaller size, or if the child head is the bigger size, or child body is the bigger size. So if it's difficult to like deliver the baby, if sometimes if the head comes outside from the birth canal, so unable to push the mother, unable to push the baby outside. So in those conditions, so half head come outside and also the remaining body is inside the birth canal. So in that conditions, if the baby is not getting the proper oxygen, so the baby may chance to get the difficulty in breathing, or if the baby swallow any fluid or amniotic fluid. So because of the baby swallow any amniotic fluid or if any abnormal fluid, so it may give the choking or asphyxia. So because of the asphyxia, so the baby may chance to get the difficulty in breathing. So because of the difficulty breathing, the baby unable to take the oxygen properly. So if there is no oxygen, lack of oxygen in the blood, so it because of lack of oxygen, so the blood circulation is also going to decrease into the brain tissues. So because of the decreasing the blood circulation, decreasing the oxygen concentrations, so it may gives the tissue damage. So that is the is may leads to the cerebral palsy. So that is in the 1860s theories. So after that, so many research analysis, so many causative factors and also so many risk factors are identified. So we are going to discuss here everything. So in the 1897 and also so Sigmund Freud so suggested that difficulty in the birth was not the cause, but only symptom of other effects on the fetal development. So according to the Sigmund Freud in the 1897, he suggested that so many reasons, not only for the asphyxia or not only difficulty in the delivery of the baby, so it's not only causative factors. So according to the National Institute of the Neurological Disorders and Stroke, so in the 1980s suggested that only small number of the cases of the CP are caused by lack of oxygen during the birth. Only little amount of cases are due to because of the oxygen, lack of the oxygen in the during the delivery time. So if you see the epidemiology, the incidence of the cerebral palsy is about the 2% out of 100,000 live births. So only is 2% is there if any 1,000 births are there. The incidence is higher in the male than the females. So in most of the cerebral palsy patients are be males compared to the female patients. The other associated problems including the mental disadvantages, the IQ percentage is going to be less than 50%, and also active seizures are going to be 21%, and mental disadvantage is going to be is a less than 80 are not walking. So who are having this mental disadvantage along with the walking disabilities are going to be 20%, and also blindness is going to be the 11%. So these are the according to the statistics, the percentage will be different according to the male and female and also with the different disabilities. During the past 3 decades, considerable advances made in the obstetric and also neonatal care, but there has been no change in the incidence of the CP. So after the changes in the technology and also the delivery process and also surgical process, so up to now, there is no changes in the cerebral palsy, but now most of the people are preventing all these complications to reduce the cerebral palsy complications and also incidence. The population of the children with the cerebral palsy may be increasing due to the premature infants who are surviving in the greater numbers is a higher incidence. So because of the nowadays all the technological development as well as so these people, the cerebral palsy patients may chance to get the risk factors before the premature or in case of the like a prenatal. So that means before delivering also the baby may chance to get the complications. Those babies are more prone to get the cerebral palsy complications. In normal weight terms, infants and also longer survival. So who are having the weight gains or maybe if the baby is the preterm baby or full term baby, So may chance to get the, like if it is the preterm also may chance to get the cerebral palsy, or in case of the full term also, if it cross, if the baby is difficult to, if the mother difficult to deliver also may chance to get the cerebral palsies. So we are going to discuss about the causative factors of the cerebral palsy. So these causative factors are divided into three classifications. So these three classifications according to the cause of the time period of the causative factors. So these are going to be the most of the cerebral palsy cases are due to because of the prenatal cases. 70% of the cases are going to be the prenatal. So that means if the mother having any problems before the delivery, or if the baby having any problem in the before the delivery, so those causative factors are called as prenatal causative factors. Perinatal causative factors are the during the delivery time. So that means if the baby having any difficulty or during the delivery, or if the mother having any complication during the delivery, so may chance to get the cerebral palsy. But this is the minimal, that is a 5 to 10%. The remaining 20% are going to be is the related to the postnatal causative factors. So here we are going to discuss about the, especially the prenatal causative factors. The prenatal causative factors are if the mother having any infections, such as the maternal infections, such as rubella and also herpes simplex. So if any infections related to the rubella or herpes simplex, so it may use the complications related to the cerebral palsy. So it may affect the child and also may use the cerebral palsy complications. And also inflammation of the placenta. Any is the chorion and amniotitis, any inflammation of the amniotic fluid and amniotic sac, so it may use the cerebral palsy complications. RH incompatibility and diabetes during the pregnancy, genetic causes, exposure to the radiations, and maternal jaundice. So that means in the during the delivery time or during the pregnancy time, carrying time, if the mother having any related to the like a diabetes or maybe is any genetic cause factors, or if the mother exposed to the any radiations, or maternal jaundice, if the mother having any jaundice related to the any bilirubin level is are increasing related to the any like a hepatic disorders such as the liver disorders. So these causative factors are may chance to get the cerebral palsy in the during the prenatal causative factors. Perinatal causative factors. Perinatal causative factors means if the mother having any difficulty during the delivery, or mother or a baby, if anybody having any like a complications during the delivery time, may chance to get the cerebral palsy. So these are this prematurity. So prematurity means if the mother having any complications related to the placenta previa, or maybe the if the abnormal like if the displacement of the baby of the, that means the mother cannot hold the baby in the placenta, so in the uterus, so because of the prematurity, so may chance to get the delivery before the 9th month or full term of the baby. So in case of the 7th month or 8th month, in that month, if the mother deliver the baby, in that time the baby won't get any like a development of the respiratory functions and also cardiac functions. So because of the immaturity of the baby, if they deliver, so they may chance to get the cerebral palsy. And also next one is the asphaxia. Asphaxia means if the baby, if the mother pushing the baby, if the mother head is, if the mother birth canal is not sufficient space for the baby passing out. So if the baby stuck in the birth canal, such as the vagina, if the baby stuck in the vagina, if the space is not enough, so if that time if the baby head comes little bit, so if the baby cannot breathe properly. So if it's stuck or if the obstructions, sometimes the baby may swallow the amniotic fluid or maybe the blood or whatever the fluids are there. So if the baby swallow the blood or fluid, amniotic fluid, so it may obstruct in the throat or maybe distribute and also may goes to the lungs. So because of these obstructions, the baby cannot breathe properly. So it may use the hypoxia. Hypoxia means the decrease the oxygen levels. So if they decrease the oxygen levels in the blood, so it may give the tissue damage. So where the blood is going to be supplied to the tissues, so it may decreasing the oxygen levels. So it may give the damage to the brain tissues. And also next one is the meconium aspirations. If the baby swallows that means the placental materials, if they swallow, so may chance to get the obstruction in the like a throat, and also it may use the hypoxia and also gives the oxygen supplies to the brain tissues. or any birth trauma, or in case of the birth trauma, if the baby cannot come outside properly. So while giving the delivery, so have to do some forceps delivery or vacuum delivery, or sometimes have to do the, so different type of the conditions, how to do the surgical procedures, or maybe the normal delivery. So how to give the like a forceps delivery. In those conditions also, if the baby is not fit properly, sometimes it may compress the brain vessels or blood vessels. So because of the blood vessels, also decreasing the blood supplies to the brain, so it may use the cerebral palsy. And also disproportions if the baby is not proper, like a breech delivery, or if the baby is positioning is wrong positions, so it may use the abnormal deliveries and may chance to get the cerebral palsy. And also rapid delivery, low birth weight, and also coagulopathies. So it's a rapid delivery. If the delivery is a very rapid, or sometimes they may chance to get the cerebral palsy also with decreasing the blood circulations. The low birth weight. So in the premature delivery also, who are having the low birth weight, if it's not developed properly, the normal development or the milestone development, so it may delay, may chance to get the cerebral palsy complications. Coagulopathies is related to the any blood abnormalities, any diseases related to the blood also may chance to get the cerebral palsy. So coming to the postnatal causative factors, these are the very, very common. So maybe because of the damage to the brain. So is there maybe direct injury or maybe indirect injury? So if you see the brain damage secondary to the cerebral hemorrhage, so such as the trauma, infections, or anoxia. So if the baby fall down from the from the bed or from the mother hands, or maybe so anything, if any direct trauma, if any baby hit the injury to the head, so may chance to get the cerebral palsy complication, may chance to get the cerebral palsy, or maybe in case of the any infections, or especially encephalitis, or maybe in case of any infections to the brain, so may chance to get the cerebral palsy. And also next one is going to be the motor vehicle accidents. So nothing but is the road traffic accidents. So because of the head injury, so it maybe gives the hemorrhage or ischemia or blood clot inside the brain. So may chance to get the cerebral palsy. And shaken baby syndrome. Shaken baby syndrome means after the delivery, if the parents or mother or father or caregivers, someone is playing with the baby. So if they shake the head, like if they're playing, if they lift the baby, if they shake the head or while playing, if they move this side and right or left or upwards, if they move up and down. So because of the shaking, so the inside the brain is may use the compression to the brain tissues, and also may chance to get the cerebral palsy. And also in case of the drowning, so if the baby fall in the any water or tub, or maybe in any swimming pool or any water like a tank, so make the baby swallow the more water content. So sometimes if they save the survive, they save the baby also. Sometimes if the baby swallow more amount of the water, so because of these things may chance to get the difficulty in breathing, and may chance to get the decrease in the oxygen levels to the brain tissues. So those people may chance to get the cerebral palsy. And also lead exposure, so who are prone to exposed to the this lead materials, also one of the causative factor the cerebral palsy. Coming to the meningitis, is infections, and also especially the meninges, that is the dura mater and pia mater and arachnoid mater. So this is a covering layer of the brain and spinal cord. So if any inflammations, so such as the encephalitis, so Epstein-Barr encephalitis or meningitis with staphylococcus infections, so or herpes simplex virus. So these are also one of the causative factors. So for the infections, so because of the after the delivery of the baby grows also in the first 1 month or maybe 1 year period of the time, if the baby get any infection related to the brain, or may chance to get the cerebral palsy. And also additional risk factors for the cerebral palsy, including the kernicterus. So that means that the baby exposed to the high levels of the bilirubin. So if the because of the increasing the bilirubin levels may damage the brain tissues, it may give the cerebral palsy. Or in case of the methyl mercury exposure, or in case of the genetic causative factors. If the mothers or family having if the parents The family members, anybody having the genetic causative factors, such as the any history of the previous history, or is the hereditary causative factors of the cerebral palsy, also may chance to get the cerebral palsy for the children. So these are the causative factors for the different type of the causative factors: prenatal causative factors, and perinatal causative factors, and also postnatal causative factors. So coming to the classification of the cerebral palsy, so this classification depends upon the involvement of the limb. So just now we discussed cerebral palsy is nothing but the cerebral paralysis. So because of the damage of the brain tissues, so it's going to give the weakness or paralysis in the upper limb as well as trunk and also lower limb. So for examples, if any injury in the right side of the brain, so those people are going to get the effects to the left side of the upper limbs as well as lower limbs. So the tissue damage in the right side of the brain, the effect is going to the left side. So because of the pyramidal tracts are going to be in the cross direction, the decussation will be in the opposite directions. The fibers from the right side, it is going to comes to the left side. From the left side, is going to the comes to the right side. So if any damage to the left side, the symptoms are going to comes to the right side. So that's the reasons that depends upon the involvement of the tissue damage, the symptoms are going to be varied. For example, here we are going to discuss about the depending on the topographical distributions, it is called as the monoplegic, diplegic or paraplegic, triplegic, and also hemiplegic, tetraplegic, and also double hemiplegia. So this here we have to understand what is mean by plegia, what is mean by plegia, what is mean by paresis. Here plegia means if any loss of function, completely loss of function is called as plegia. For example, hemiplegia. Hemi means half of the body is going to get the affected. So half of the body is going to be, for example, if you see the hemiplegia, hemiplegia means half of the body, or for example, the right side of the body is going to get the paralysis. So that is complete loss of the paralysis, complete loss of the motor functions as well as sensory functions. So that is called the hemiplegia. So if you see here, so half of the body is going to be affected. So that is hemiplegia. Hemiparesis means, so that is a partial loss of the functions. So half of the body is going to be the upper limbs, trunk, and lower limbs are going to be is a partial loss of the functions. So that means they are unable to lift the complete the upper limbs or hand or is the lower limbs. But they are able to try to do the, if they are, for example, hemiplegia, they can lift up to some extent of the movement. They are going to do the some abnormal movement, but it's not complete movement. But that is called as the hemiparesis. Their hemiparesis means they are going to loss of the functions, but minimal loss of the functions. Normally, if you want to do the normal movement, so this is the normal movement. So they are going to do the movement, but up to some extent. So that is called as the hemiparesis. Paresis means partial loss of the functions. So same thing we have to apply for the monoplegia and monoparesis. Monoplegia means single leg is going to be single, either upper limb or either lower limb is going to be affected. In the upper limb is affected means either upper monoplegia, that is upper limb monoplegia or lower limb monoplegia. So hemiplegia means the half of the body is going to be affected. If the right side body is affected means the problem is in the left side of the brain. The problem in the left side of the brain, so it leads to the right side of the half of the body is going to be affected. In the same thing, so if you see the diplegia or tetraplegia, so if you see it here, diplegia means all four limbs are affected. So both legs are more affected than the arms. So here also going to be, if you see the diplegia, so it's going to be lower limbs are more affected, upper limbs also affected, but less amount of, that means the loss of function is more in the lower limbs than the upper limbs. So coming to the quadriplegia means the all the limbs are going to be affected, upper limbs and also lower limbs, trunk also going to be affected. So total the body is going to be affected. So in case of the quadri means four, tri means three limbs, di means two. So if you see the diplegia, so both upper limbs and lower limbs are going to be affected, but lower limbs are going to be more affected. So that is called the diplegia. Triplegia means if you see here, the three limbs are going to be affected. So both upper limbs affected, either one lower limb, or both lower limbs are affected, either one upper limb is going to be affected. So this is also triplegia, and this also triplegia. Either any two is going to be affected, upper limbs and lower limbs, but one limb is going to be spared, either upper limb or lower limb. And coming to the triplegia and diplegia and triplegia, and these are the depends upon the involvement of the tissue, involvement of the brain structures. So just now we discussed monoplegia means a single limb is affected. Diplegia affected means the lower limbs are affected with little or no upper body spasticity. Spasticity means the upper motor neuron type of the lesions. If anybody get the damage in the brain and spinal cord, so it may gives the abnormal muscle tone, so which is called as the spasticity. So it increasing the muscle tone, the muscle is becomes very tight and rigid. So that condition is called as spasticity. So the most common form of the spastic forms, so these are going to be the most people with the spastic diplegia are fully ambulatory, but are the tight and also have scissoring gait. So who are having the spastic muscles, so especially in the lower limbs, in the diplegia, so they are going to get the scissoring gait. Scissoring gait means the limbs are going to, lower limbs are going to be tight. So it comes like a crust. So that means they're going, the limbs are going to be is a cross positions. This is the right lower limbs. For example, if the right lower limb is a left lower limb, it's going to be cross. If they walk, they have to cross like a very close, a tight manners. So that is called as the scissoring gait. Gait means walking patterns. So you know scissor, right? How the scissors are going to be, scissors are going to be in these positions. So if you want to cut something, so same thing, this cross leg is going to be, if they walk, they're going to be like a cross leg postures. So that for the scissor, the pattern of the gait pattern is called as scissoring gait. So who are having the diplegia, the flexor knees, hips to varying degrees and also moderate to severe adduction are present. So because of the adductor tightness of the hip adductor muscles, so the hip adductors, the inside medial thigh part muscles are going to be tightness. So because of the tightness of the adductor muscles, so we'll get the scissoring gait. So this is going to be often is the nearsighted and also intelligence is unaffected in one third of the spastic diplegias. Strabismus may be present. So who are having the diplegia, so they are going to be is their normal like an IQ is going to be normal. So their intelligence is not going to be affected. But only thing is they're having the scissoring, like a scissoring gait, especially the muscles are going to be tight because of the upper lower limbs involvement, and also because of the this lower limb involvement, like a diplegic in the scissoring gait, so they're unable to walk properly. They're going to walk like a scissoring gait. And also, especially one third of the spastic diplegic patients are going to be strabismus. They are going to have the strabismus. Strabismus means it's going to get the squint. The eye, one eye is going to be squint appearance. So they can, if they look forward, so the one eye is going to be deviate to opposite side. So unable to, but they can see the direct like a straight positions, but the eye deviation is going to be opposite side. So they are looks like is the looking for someone like a is some other place. So that is called as strabismus, also called as squint. Normal terminology we called as squint in the eye. Coming to the hemiplegia, so hemiplegia is going to be the half of the body is going to be affected. So it's because of the problem. For example, right side is affected. So the problem lesion in the left side of the brain. So although they generally have the dynamic equinus on the affected side, so they are going to get the limb is going to be the equinus deformity. The foot is going to be equinus deformity. So because of the equinus deformity, so they're going to get the circumduction gait. If they walk, they're going to be like a rotatory like a half circle directions walking patterns. So they're going to get, so that the gait pattern is called as the circumduction gait. So coming to the triplegia, so three limbs are affected usually, both upper limbs in the one lower limbs. Sorry, both lower limbs and also one upper limb is going to be affected. So that is called as the triplegia. Quadriplegia means the all four limbs are the more or less equally affected. So upper limbs as well as the lower limbs are going to be affected. So least likely to be the able to walk, but here is going to be they're not going to get the complete the paralysis. So they're going to get the some like a walking difficult they can walk and also with support and also with like a supported devices, crutches and also walkers. So with but they're going to have children's having the tremors, that is the hemibalismus, and also impairs the normal movements. So hemibalismus means is a motor abnormality. So they are going to get the, if they walk, they are going to get the shivering. So they are going to get the shivering in the movements. So that is called the hemibalismus. So it's going to get the abnormal movement disorders who are having the basal ganglia lesions. So, and also is impairs the normal movement while walking. So the normal movement is going to be altered. So coming to the, depending on the tone of the movement pattern, so this cerebral palsy is going to divide into the four type of the cerebral palsy. So just now we discussed depends upon the topographical involvement. So here is going to be the different type of the cerebral palsies. Depends upon the involvement of the tissues. So this is going to be the spastic type of the cerebral palsy. So spastic type is going to be commonly seen in case of the like in the cerebral palsy, hemiplegic and also quadriplegic. Spastic means the muscle tone is going to be altered. This is going to be increasing the muscle tone. That means the uh, it's going to be very tight and the muscle is going to be tight and also is going to give the deformities. So unable to maintain the posture properly. So especially in case of the hemiplegia or diplegia, quadriplegia are going to get in the spastic type of the paralysis. And also next one is the ethetoid type and also dyskinetic. So these are is going to be the, so this first one is going to be hemiplegia, diplegia, and quadriplegia is going to be the partial involvement. So that means either half of the body or the only lower limbs, or is a partial involvement going to be happening. So in case of the ethetoid and dystonic, so it's like is a dyskinetic, like a cerebral palsy. So in those conditions, they are going to get the total body involvement. So if they want to do the movement also, all bodies are going to give the shaking movement or abnormal movement, or is going to give the postural abnormalities. All things are going to be involved, especially in case of the ethetoid and dyskinetic. So that means if they want to perform any skill movements, so they are going to get the difficulty in the hand movement, as well as they are going to get the shivering movements in the head and also other part of the body. So these are the symptoms we are going to observe who are having the ethetoid and also dyskinetic type of the cerebral palsy. Ataxic type of the cerebral palsies are going to be, ataxic means unsteady gait. Unsteady gait means if they stand or if they walk while walking, they're unable to maintain the balance and also unable to maintain the coordinations. So they're going to get the incoordination and also loss of balance. So especially who are having the, in case of the cerebellar involvement, so this will be the like in the ataxic type of the cerebral palsy is going to be will get. And also these are the dyskinetic that are going to be especially for the basal ganglia structures are going to be involved in case of the ethetoid and also dystonic. So this one is going to be in the spastic type of the cortex is going to be involved because of the cortex involvement. So it will be the partial involvement of the cerebral palsy. And also in case of the flaccid or hypotonic is going to be get the loss of the muscle tone. So the muscle tone is going to be decreased in case of the flaccid type of the cerebral palsy. Sometimes it's going to be the mixed type of the cerebral palsy. Mixed means is going to give the symptoms related to the spastic type and also dystonic type and also flaccid and also spastic type and also hypotonic type. So all combined together, so it is called the mixed type of the cerebral palsy. So if you see the spastic type of cerebral palsy is mostly commonly we can see the cerebral palsies are is a spastic type. Around the 70 to 80% of the cases are the spastic type of the cerebral palsy. So this cerebral cortex is affected. So here is the problem involvement structure is the cerebral cortex is going to be involved. So because of the cerebral cortex, so is upper motor neurons are going to be affected. So because of the involvement of the upper motor neurons, so is going to give the spasticity. So that is abnormal muscle tone. So this is going to be is going to be more of the spastic therapy is accompanies any of the other type of cerebral palsy in 30% of the all the cases, and also is going to be accompanied with the other type of the cerebral palsy. So is going to be is a monoplegia, diplegia, triplegia, hemiplegia, and quadriplegia. So especially you are having the damage in the cerebral cortex, so either may chance to get depends upon the involvement of the structures is only like if the monoplegia means only upper limb fibers are going to be involved. So or maybe is the only leg fibers are involved, so they may chance to get the lower limb like the effect of the lower limb, or maybe is the lower limbs are both diplegia is affected. So depends upon the site of the tissues. So it may give the either monoplegia or quadriplegia or diplegia. Ethetoid type of the cerebral palsy. So these are going to be the mixed muscle tones. So spastic muscle tone and also flaccid muscle tone. So here is first we have to understand what is spastic muscle tone and also what is flaccid muscle tone. Spastic muscle tone, which is nothing but is the increase the muscle tone. So if the group of the muscles are going to be affected, either flexor compartment is going to be affected or extensor compartment are going to be affected. So one group, it's not an individual muscle tone. So if you see the muscle spasm, only particular muscles, like a muscle, individual muscle is going to get the spasm. But here, group of the muscles are going to be affected in case of the spastic muscle. Flaccid type of the muscles means completely muscle tone. So muscle tone, loss of the muscle tone. Because of the muscle tone, so if you palpate the muscles, it will be flabby or like a very smooth, and also it's going to be like a cushioning type of the like a tone. So in, for example, normal tone is going to be, if you palpate, you feel some tension. So that is called as like a tone. So in case of the abnormal tone, if you palpate, you feel the more tightness. In case of the flaccid tone, if you palpate, you feel the flabby or very softness in the muscle tone. There is no tone in the muscles. So it is often shows the involuntary motions. So if they sit or stand or resting positions also, they're going to get the involuntary movement. So there may chance to get the movement in the head, may chance to get the movement in the hands or legs. So if they try to give any like a task oriented, like if you give any task to hold any pen or pencil, or if you while taking the like taking some water, in that conditions they are going to get the abnormal movements in the like a limbs, other parts of the limb. If they try to hold something with hand, they are going to get the movement in the other parts of the body. So these are the abnormal movements, involuntary movements. So because of these movements are going to be because of the extrapyramidal system and also pyramidal tract. So extrapyramidal tracts are going to be so if any damage, nothing but its extrapyramidal system is going to be is there in the basal ganglia, sort of surroundings of the basal ganglia. So it may damage and also it may use these involuntary movements. So such as chorea, ethitosis, and also dystonia, dyskinetic movements, hemipaleismus. So these are the related to the extrapyramidal lesions. And also it occurs in the 10 to 20% of all the cases. So especially in the newborn infants, high bilirubin levels in the blood, if the left untreated, can lead to the brain damage in certain areas. So so that is the reason this is called like the kernicterus. So this is a because of the increasing the abnormal level of the bilirubin. So it's nothing but is the which is produced by the liver. So if any increasing the levels of the bilirubin, so may chance to get the damage in the brain. So it may give the ethetoid and also dyskinetic type of the CP, cerebral palsy. So this may also leads to the ethetoid type of the cerebral palsy. So ethetoid tissue means ethetoid type of the cerebral palsy means so unable to control the movement, any patterns. So is going to give the abnormal shaking movement we can observe who are having ethetoid type of cerebral palsy. So coming to the ataxic type of the cerebral palsy. So ataxic type of cerebral palsy is because of the damage of the cerebellum. So also called as the small brain, so which is located in the posterior cranial fossa. So if any damage in the cerebellum, so it may use the like a cerebral palsy, it may leads to the cerebral ataxic type of the cerebral palsy. So just now we discussed spastic type of cerebral palsy. For example, if the right side damage, the symptoms are going to get the left side. But in is going to be compared to the cerebrum and cerebellum. So it's going to be totally different. So that means in the cerebellum, in the cerebral hemispheres, if you see the cerebellar hemisphere, so damage in the right cerebellar hemisphere, for example, the posterior cranial fossa, right side cerebellum is involved means, so the symptoms are going to be towards the same side. So that is a difference between the cerebellar hemisphere and also cerebral hemisphere. So if anybody having the damage in the left side of the cerebellar hemisphere backside, the posterior cranial fossa, so those patients are going to get the left side of the symptoms. So that means especially they're going to get the loss of coordinations and balance. So it may chance to get towards the left side. So the same side is going to be affected with the cerebellum injury. So here is going to get the most common symptoms of the cerebellar or ataxic type. So this is going to give the hypotonia and also tremors. So the muscle tone is going to be decreased. So this especially the cerebellar hemisphere functions, cerebellar hemispheres functions are going to be control the muscle tone. So if any damage in this muscle cerebellum, so it may use the decreasing the muscle tone and also tremors. So tremors means involuntary shaking movements. So these are the major symptoms of the ataxic. So we are going to discuss in the individually. So what type of the symptoms we are going to identify. So next one is the hypotonic type of the cerebral palsy. So this hypotonic cerebral palsy having the musculature, that is the limb, and also can move only little or not all. So the child is going to be get the difficulty in the movements. So because of the decreasing the tone in the muscles. So if you palpate the muscles are going to be flappy. So it's going to be very smooth and also very soft. So there is no tension in the muscles. So the location of the damage is a widespread in the central nervous system. So it's going to be location is going to be the widespread, and also although physical therapies usually attempt to strengthen the muscles, it is not always fundamentally is effective. And also, so only treatment procedure for the hypotonic cerebral palsy. So physical therapy is going to be improve the muscle strength. So we'll improve all the functional activities with the physiotherapy. And also mixed type of the cerebral palsy. So mixed type of cerebral palsy is going to give the, along with all the type of, is going to be spastic type and also flaccid type, and also who are having the most commonly mixed with the ethetide. So with the dystonic and ethetide, and all the symptoms are going to see who are having the involvement of the pyramidal and also extrapyramidal system. So that is the reasons they are going to get the movement disorders such as the hemiplegia, chorea, ethetosis, dystonia, all the symptoms, along with the, we'll get the spastic symptoms. So these type of all the symptoms we are going to see, in especially while having the like a extrapyramidal system involvement. So coming to the, depending on the functional levels, so and also gross motor functional classification systems. So according to the age, and also is going to give the, these gross motor functional activities are going to be different. So the classification will be different. So this is going to be, so according to the age group, the development will be different. So this one is going to be how we are going to see the like a gross motor functions, and also language system, and also social skills, how is going to be developed. The milestone development we will discuss in the next class, how the milestone development at the age of the like a first month, and also first 3 minutes, how the like a 3 months, how the development will be, next month 3 months, and also until the 1 year, 2 years, 5 years, how the baby development will be there. So in the motor development, as well as the language, social, and also cognitive development. So all the development, how it takes place in the normal child. So how we are going to compare with the abnormal child in the cerebral palsy. So how it's going to be altered in the cerebral palsy. So this motor development and milestone development we will discuss in the next class. So coming to the pathological changes in the cerebral palsy, if you see the pathological changes, just now we discussed, so depends upon the causative factors. So depends upon the either prenatal causative factors, and also perinatal causative factors, and also postnatal causative factors. So coming to the these pathological changes, the main pathological involvement is periventricular, the leukomalacia is the most common finding in the CP. So it's nothing but is the white matter involvement. If the damage in the white matter, so it's going to be the, when the white matter softens and dies around the lateral ventricles. So lateral ventricles, and also third ventricles, fourth ventricle, and lateral ventricles. So these are the ventricular system in the brain. If you see in the ventricles is nothing but the fluid filled cavities, such as the fluid filled and CSF filled cavities. So these are mainly is the, if any damage, if any white matter damage surrounding to the, this the lateral ventricles, so it may give the cerebral palsy. So this the periventricular leukemia results from the trauma or hypoxia. So just now we discussed all the causative factors. So if any related to the trauma or decreasing the oxygen supplies, so it may damage to the these periventricular areas. So surrounding the ventricle regions, if any damage of the white matter, so it may chance to get the cerebral palsy. So this may be development of the cerebral palsy, epilepsy, developmental delays, learning disabilities, visual disturbances, and other disabilities may chance to get the, because of the periventricular leukomalacia. So that means the leukomalacia is a white matter is going to be get the damage. So these are going to be children with the spastic diplegia, most commonly who already having this periventricular leukomalacia. So is malacia is going to make chance to get the cerebral palsy. And also one of the causative factor we already discussed about the Kernick Trust. So it's nothing but is the bilirubin encephalopathy. So if is there any basal ganglia, in the bilirubin levels are increased in basal ganglia seen in the ectotype cerebral palsy following the diagnosis of the kernicterus. So if any increasing the bilirubin levels in the basal ganglia also one of the causative factors for the cerebral palsy. Coming to the focal cortical infarcts, so if any blood occlusions or any damage, any blood like a decrease in blood supply, or because of the any atherosclerosis or any infarct means any blood clots. So involving in the both gray and white matters are found in the patients with the hemiparesis, are typically related to the MCS stroke, the middle cerebral artery. So in the so if you see especially for the if you see the cerebral blood circulation to the brain, so the carotid arteries, so this so common carotid arteries, so if it's going to give the blood circulation to the brain, so if anything related to the these blood vessels are going to be supplied to the anterior, is going to divide into the anterior cerebral artery, posterior cerebral artery, and also the middle cerebral artery. So is these cerebral arteries are going to be distribute the blood throughout the brain. So if any abnormality, any infarct, any blood clot in the middle cerebral arteries, especially, so those people are going to get the stroke. So it may lead to the hemiparesis and also hemiplegia. And also brain malformation can be found in the neuroimaging is approximately the 10% of the children's. Any abnormal development in the like a brain also may chance to give the cerebral palsy. So according to the some statistic and research evidence based, so it shows that 10% of the children's having the brain malformations. So abnormal formation of the brain structures, it may give the cerebral palsy. So coming to the signs and symptoms of the so different type of the cerebral palsy. So just now we discussed the spastic type and also ectotype type, dystonic, and also. So what are the symptoms we can observe in case of the spastic type? So in the spastic type of the cerebral palsy, first one is going to be hypotonia. Hypotonia means increasing the muscle tone. The muscle tone is going to be increased. If you do the movements, it's difficult to do the movements because of the increase the muscle tone. So decreasing the flexibility because of the increasing the muscle tone. If you check the reflexes will be exaggerated and also positive Babinski sign. So reflexes are going to be exaggerated. Reflexes is going to be increased. For example, if you check the deep tendon reflexes, if you tap on the biceps tendon, so normal response is going to get the flexion movement. This is the flexion of the elbow. But in case of the spastic paralysis or spastic cerebral palsy, if you tap here, so the movement is going to be very fast movement. So the movement is going to be exaggerated. The movement is going to be increased. The response is going to be increased. So because of the hypertonicity. And also the positive Babinski sign. So this is the pathological reflex. Commonly we can find this the reflex who are having the any injury, upper motor type of neuron injury, upper motor neuron injury, especially any who are having the brain injury, as well as if anybody having the like a spinal cord injury. So the Babinski spine is Babinski reflex is nothing but if you stroke on the lateral border of the foot. So that means if you imagine this is a foot, if you stroke on the lateral border of the foot, so from here, if it comes to the medial side, so the big toe going to be extension, the remaining fingers are going to be fanning. So here I'm going to show you the image. So give me 1 minute. Yeah. So this is a Babinski reflex. So Babinski reflex means, so if you do the stroking and if you take the reflex hammer with a sharp object, so if you stroke over from the lateral border of the foot, from here to until the medial border of the big toe here, so until the big toe, so normal response is going to be, the negative response means going to be, all the toes are going to be the flexion. So this is the normal. So this is going to be the negative reflex. But in case of who are having the brain injury and spinal cord injury, if we stroke from the lateral border of the foot until to the big toe, so the big toe is going to be extension, and also the remaining fingers are going to be the fanning. So it's going to be spread away. So it's going to be give the abduction movement. So that is the Babinski sign. This is commonly seen who are having the like a cerebral palsy and also stroke patients or spinal cord injury patients, and also in case of the brain infections such as the meningitis, encephalitis. So many conditions. So related to any upper motor type of the neuron injury, so this sign is going to be positive. So that is called as the Babinski sign. So this also normal reflexes. If you stroke here, so this is going to get everybody is going to get the flexion movement. So this is the normal response. Normally, this is called as the plantar reflex. So, if it is a normal response to the plantar reflex, so who are having this is the abnormal, so an extension of the big toe, the remaining fingers are going to be fanning. So that is a pathological reflex. Who are having the brain diseases, only they are going to get the abnormal reflex. So this is the positive sign in case of you already having the spastic cerebral palsy. So next one is the clonus will be present. Clonus means who are having the more spasticity, is grade 4 spasticity. If you check the scale, the grades of the spasticity, who are having the grade 4 spasticity, so that means unable to do the passive movement. And the clonus means if we give a passive movements to the lower limbs, so he's going to get the rhythmic movements in the, if you give the ankle movement to the dorsiflexion, if you leave that, so he's going to get the rhythmic movement, is going to oscillatory movements continuously up to some extension of the time. So it is called as the clonus movement. So this clonus is commonly seen who are having the hypertonicity. That means if you give a sudden stretch to the dorsiflexion, or maybe give the extension of the wrist. So most commonly we can observe who are having the severe spasticity. If you give the sudden dorsiflexion, so he's going to get the shaking movements of the limb. So that is called as the clonus. So, and also next one is poor voluntary movements. So if they want to do some activities voluntarily, so it's going difficult to do because of the tightness of the muscles, because of the hypertonicity. So unable to do the voluntary movements. And also scissoring gait. So because of the adduction of the hip adductor muscles, so may chance to get the scissoring movements. The legs are going to be crossed. If they walk, they are going to walk like a scissor. So that is called the scissoring gait. And also low intelligence and loss of memory, so may chance to get who are having the damage to the cortical system, and also may chance to get the epilepsies. So that means the fits they may chance to get. So these are some symptoms of the spastic cerebral palsy. And also we get the synergetic patterns of the movement, contractures and deformities and wasting. So because of the muscle tightness, so it may use the deformities. For example, tightness of the wrist flexors is going to give the flexion deformities of the hand. And also because of the adductor tightness of the shoulders is going to give the adductions. And also tightness of the biceps is going to flexion deformity. So there may chance to get the like a flexion and also adductions and also flexion deformities of the wrist. So this commonly seen in the spastic type of the cerebral palsy. This is the upper limb. So if you go to the lower limbs, so it may use the flexion deformities in the hip and also flexion deformities in the knee and also tightness of the like a calf muscles. It may use the plantar flexions. So these are some deformities because of the improper movements and also inactivity, and also will get the wasting. That means the muscles are going to give the small side. The muscle becomes very thin. And also is the adduction, internal rotation of the shoulder. So because just now we discussed, so because of the pectoralis major tightness, adductor muscles is going to give the adductions, and also overactivities of the internal muscle, internal rotators, so is going to give the internal rotations. Flexion of the elbow, pronation of the forearm, and is going to be the flexion, and also wrist flexion, thumb in the one hand, and also flexion, adduction of the hip joint, knee flexion, and also plantar flexion. So just now we discussed because of the tightness of the calf muscles and also hamstring muscles, it's going to give the flexion deformities, hip flexion, and also because of the iliopsoas muscle tightness. So here, if you understand about the deformities, according to the deformities, we have to rehabilitate and we have to give the stretching and strengthening exercise according to the involvement of the muscle. And also extrapyramidal CP. Extrapyramidal means just now we discussed. So ethetoid type of the cerebral palsies. So ethetoid and also dystonic type and the chorea and also hemiplegia. So these are all going to be like related to the extrapyramidal systems. So this maybe is affects the limb, face and tongue and speech also going to be affected, characterized by the continuous muscular worm-like movements. So it's going to be the abnormal movements. She's going to get the shivering, shaking, tremors. So all the symptoms are going to be, we can found in case of the extrapyramidal system RCP. Postural instability and also decrease the movements in the prone positions, fluctuations of the tone from the high to low. So the tone is going to be altered, depends upon the time and situations. Reflexes are usually normal. The muscles are able to contract. So if you check the reflexes are going to be normal. But in the spastic one, the reflexes are going to be exaggerated. So if you are having this extrapyramidal, so the stability is going to be decreased. If they want to do any activity, so they cannot maintain the stability, or they may chance to get the abnormal movement. Difficulty to look up, and also because of the unable to look up, so is extrapyramidal systems are going to get the like all systems on face and also neck muscles are going to be affected. Emotional liability, so sometimes they are going to cry and laugh without reason, also they are going to cry and also laugh. Arms are more affected than the lower limbs. Sucking and feeding problems at the time of the birth time, and also delayed head and trunk controls. So who are having the ethitide and also the choreo and hemibalismus and also dystonic type of the cerebral palsies. So they are going to get the delayed milestones. And also especially trunk and head and trunk is going to be more affected. So maybe either quadriplegic or later is the hemiplegic. So may chance to get the either quadriplegic, four legs are involved, four limbs are going to be involved, or maybe half of the body is going to be affected. So the subtypes are the dystonic, ethitide, chorea, and chorioid, and the hemibalismus. So the body is going to be rigidity. So they may chance to get the rigidity. So in case of the ataxic type of the cerebral palsies, so this going to be, they are going to get the balance problem and also incoordinations. Ataxia means the unsteady gait. So they are going to get the incoordinations and also intentional tremors. Intentional tremors means if they want to try to do any activities or if they're taking rest time also, they are going to get the shivering movements in the hands and neck or head or legs. So is a tremors means the abnormal involuntary movements in the limbs, uncontrolled involuntary limbs, and also decreasing the muscle tone, hypotonia. Nystagmus, nystag means the uncontrolled rapid eye movements. So they cannot control the eye movements. They can watch here, they can up and down, they cannot control the eye movements. So that is called the nystagmus. Diminished the reflexes. So because of the hypotonia, because of the involvement of the cerebellum, so it's going to give the reflexes are going to be diminished. Speech and also visual, hearing and also perceptual problems we are going to find who are having the cerebellar involvement. Joint hypermobility because of the decreasing the tone, dysmetria, so unable to like a distance measure the distance. So if, for example, for them, if you ask them to try to touch the nose, finger nose test, we can ask them to, we can just check the dysmetria, ask them to touch the nose. So normally who are having normal, they can touch the nose easily because of they know the distance between the finger and also nose. But who are having this ataxic type of the cerebral palsy, cerebellar injury, so they are going to be like they don't know where is the nose, so they are going to be difficulty find the nose because of the distance of problems. So this is the like a special test to identify the dysmetria, finger nose test. They're unable to touch the nose directly, so they may find here and there and shaking with the shaking. And also incontinence, that because of the bowel and bladder muscle weakness, so they're going to get the urinary incontinence or maybe it's a fecal incontinence. Postural instability, so they cannot maintain the posture, so because of the loss of balance and also hypotonia. Gait disturbance, so it's an unsteady gait, so that is called as ataxic gait. And also imbalance and lack of the trunk control. So because of the right side involvement, right side is going to get the weakness and also muscle tone is going to be decreased. So cannot maintain the balance and also coordinations. So it leads to the unsteadiness. So these are the symptoms in the ataxic type of the cerebral palsy. So these are the some different type of the different type of the cerebral palsies. So about the what are the causative factors, what are the types of the cerebral palsy, what are the symptoms of the cerebral palsy we discuss here. So in the next class we are going to discuss about the how we are going to educate and also milestone development, how they are going to get the milestone development. So how is the motor progressions, how is the cognitive functions, how is the social skills, language. So how we are going to see the normal development, and also we are going to compare with the abnormal development who are having the, especially in the cerebral palsy, what they are going to lose the motor development and also the skills development, like lack of the skill development. We are going to discuss in the next class, and also how we are going to educate, how we are going to rehabilitate in the another class. We are going to discuss in the another class. Okay, that's all about today's topic. Hope you understand. Okay, if you have any doubts, you can ask me through the message. I can clarify your doubts. Thank you very much. See you in the next class.